Hey everybody, just wanted to demonstrate some acupuncture for you. So I just recently got back into training, so I have a little lateral knee pain. And so if we understand when you start a new training program, new inflammation begins to arise in the body. And so we can use acupuncture to help promote blood circulation through the joint, which ultimately helps to reduce inflammation. And so I also had that grappling tournament the other weekend, and so just dealing with local pain. It's not torn because I had it tested for the ligament. I didn't need an imaging or a scan or anything like that. But so this is kind of how I take care of my body, and I will demonstrate an acupuncture treatment. All right, so. The nerves of the knee, obviously you have your IT band that runs from your hip all the way down to your knee. You have all the muscles that run on the lateral lower leg, but also the meridians of the body end in the foot, okay? And so, just turn that there. And so, so you have gallbladder channel that runs along the lateral leg. You have the stomach meridian, which runs on the front portion of the leg, starting in the hip. You have the nerve dermatomes from your lumbar nerve roots that go all the way down your leg as well. And so, in treating the knee, sometimes it actually stems from the back, but I'm going to be just treating it locally here. So, I will be starting in the IT band. So, when I feel my IT band here, it's really taut. And so whenever you start training and doing leg work and things like that, that puts restrictions into the muscle. And so when you put a needle into the muscle, it actually shuts it off, which is nice. So that relaxes the muscle, so then it can restore itself. And so I'll be starting here at gallbladder 33, threading it up. Okay. This isn't an acupuncture point, but this is where the pain is. So any site of pain, that's called an ashi point. You can put a needle there. It'll start to circulate blood there. Gallbladder 34 here, 35, 36, 37. I'll go 43. 41 in the foot. 43 and gallbladder 43 and 41. And I'll do kidney 3 as well, which, there it is. And sometimes you do get a little jolt. That's called the dachi sensation. And so it's not that it's hitting a nerve, it's more that the needle is penetrating a field, an acupuncture, an energy field within which is where an acupuncture point is. And so when you place these needles into that, it helps to disperse that your chi, and that's how the chi is what brings and pulls blood to the area. I'm gonna do stomach 36. The eyes of the knee, which is stomach 35. It's an extra point, Jiyan. Okay. And so that's threaded directly into the capsule. I'm not sure if you can quite see this. I'll grab the camera here in a second. I'll do spleen 6, which is the crossing point of spleen, liver, and kidney meridian. But that'll help with some of the dampness. Dampness is fluid accumulation. It's been wet and rainy the past few days. We'll go 36 on the other side. Okay. Let me bring this over here. And so you can see the needles in the knee here, in the leg. So gallbladder 33, local. Gallbladder 34, 35, 36, 37, all the way down, and then in the foot as well, okay? And I'll bring this heat lamp over here as well, and and I'm going to put a scalp point in as well. And so scalp motor point, the nerves of the brain actually cross, and so the right side of your brain actually controls the left side of your body, and vice versa. And so in helping to help the motor function of your knee, so if I'm treating my left side knee, I'll be needling on the right side scalp motor points, which actually the points actually cross the. Ooh, that is tender in there. That's good. The points actually cross the gallbladder channel as well, and so which will help to balance this meridian. That's tender. That is tender. So that's what that looks like here. And so these are motor points in the scalp. And so when they ask, does acupuncture hurt? It can, and I know they always say that acupuncture, the big question is, does acupuncture hurt? Yes, it can hurt, and it's because we're trying to elicit this adaptation to the body. It's not that we're attempting to cause. We don't want it to be painful, but sometimes when we make these muscles twitch, that twitch response when we acupuncture, sometimes it causes some discomfort. But the discomfort doesn't remain. More on the insert and more on the manipulation of the needle. And so that's a little bit about what an acupuncture treatment looks like. You can kind of see needles that go all the way down the leg there. So this is a little bit about some self-acupuncture care. Yes, I needle myself. Obviously, it's a little disorganized. Well, I'm doing it to myself, but it's a little bit more comfortable if you're laying down and you have the needles inserted. But this is basically how I treat myself. So call me with questions and journey on.